Good afternoon, doctors. My topic is controversies to consensus in using oils in diabetes and cardiovascular disease. I'm so sorry, my slides are not moving. Give me 1 second. Yeah.
So,
Ma'am, just click on your screen once and then just
yeah, I'll do that. Yeah. So the debate is people with diabetes are at increased risk of cardiovascular disease, and the important role of dietary changes is established. But the problem is there is no precise prescription for dietary fatty acids, as there is no precise science to drive it. Low fat diets have been recommended without much attention to the quality of fat. The debate has been fueled by publications of large studies. I'll be talking about 2-3 of them, which report seemingly conflicting results. Now, we all know that fats give us, they are energy giving foods. They're not produced by the body, but our bodies can manufacture fat from nutrients. They are absorbed more slowly than carbs. Now, I would like to talk about the basics for about 1 or 2 minutes. So fats can be saturated, they can be unsaturated, and they can be trans fats. Now, unsaturated fats can be monounsaturated or polyunsaturated, depending on the number of double bonds. So if there's one double bond, then it's a monounsaturated fat. And if there's more than one double bond, then it is called polyunsaturated fat. And depending on the position of the double bond, there is omega-3 and omega-6 fatty acid among the polyunsaturated fatty acids. Now, saturated fatty acids are usually solid at room temperature, while the unsaturated are liquid at room temperature. The trans fats are partially hydrogenated, which converts to liquid to solid at room temperature. Now, sources, we all know saturated fats are solid, so butter, cream, ghee, cheese, meat. Now, there are 2 vegetable oils, which are coconut oil and palm oil, which are rich in saturated fats. So unsaturated fats, I just told you polyunsaturated fat and monounsaturated fat. PUFA is found in soybean oil, sunflower oil, corn oil, fish oils, and MUFA in olive oil, walnuts, and almonds. Trans fat, of course, in baked foods, and vanaspati ghee, which most of us know and don't use, cakes, cookies. Now, talking about PUFA, they are essential fatty acids, essential because our bodies cannot manufacture them and we need them from dietary sources. Now, linoleic acid is the omega-6 fatty acid, and alpha linolenic acid, or ALA, is the omega-3 fatty acid, which is converted to DHA and EPA, which is eicosapentaenoic acid and docosahexaenoic acid. So, PUFA are classified either as omega-3 or omega-6, depending on whether the first double bond is located on the 3rd or the 6th carbon from the terminal methyl group. Now, long-chain omega-3 fatty acids, which are EPA and DHA, they are plentiful in fish and shellfish. Obviously, Indians, even those who are non-vegetarians, take more of chicken and mutton, red meat, and less of fatty fish, and therefore we are deficient in these fatty acids. Now, short-chain omega-3 fatty acids are ALA. They are found in plant sources like flax seeds. Now, what are omega-9 fatty acids? These are monounsaturated fatty acids, and consuming foods rich in omega-9 fatty acids instead of other types may have beneficial health effects. Now, what are trans fats and why are they attractive? Because they have a long shelf life, they are stable during deep frying, and they definitely enhance the palatability of food. Now, what is the problem with trans fats? Trans fats increase the LDL cholesterol and they decrease the HDL cholesterol. Trans fats create inflammation, which may be linked to heart disease, stroke, diabetes. They contribute to insulin resistance, and obviously this will lead to an increase in the development of type 2 diabetes. Remember, friends, even a very small amount of trans fats can harm you tremendously. Even if you get 2% of your calories from trans fats, the risk of heart disease increases by 23%. So these are some of the foods, baked, fried, creamers, which contain trans fats. Now, this is an interesting slide. Fatty acid composition of commonly consumed oils and why is it important? So my topic is to tell you that what is the consensus? There has been controversy because there have been universal guideline decrease saturated fats, and What happened is that the industry then started making polyunsaturated fatty acids. They started marketing sunflower oil, other oils, and this industry rose because oils were expensive, and all over the world we were getting oils imported. And what happened? The fatty acid composition of these commonly consumed oils is important. So it's not what oil you consume, but it is the content of saturated fat, content of monounsaturated fat, content of polyunsaturated fat, and among the polyunsaturated fat, whether the oil has omega-6 or omega-3, and what is the ratio of omega-6 to omega-3. This is very important. So these are some of the commonly used oils. Now we'll be talking about each one of them in the particular studies. Now, all plant oils are zero cholesterol. Goes without saying, so this ad is useless. No plant oil has any cholesterol. So it's a myth. A few plant oils, of course, I'll tell you, coconut oil and palm oil are high in saturated fats, and for nutritional purposes, they should be considered as solid fats. And coconut oil is one of them, which is used tremendously in the southern part of the country. Now, what about fats and why do we need them? Of course, fats are important for absorption of fat-soluble vitamins, essential for blood clotting, muscle movement. Good fats are monounsaturated and polyunsaturated. Bad ones are trans fats. And saturated fats, doctors, at the end of the talk, I'd like to clarify, they fall in the middle. So eating modest amount of saturated fats is now possible after these studies that I will be discussing. Now, certain terms, what are unrefined oils? Cold pressed oils, you keep listening. Cold pressed oil is an oil which is mechanically extracted by a machine which applies pressure and not heat. This leaves the high flavor and nutrient content in the oil, making them a healthier choice. Examples are extra virgin olive oil, avocado oil. Few examples also are of refined oils are canola oil, rice bran oil, and sunflower oil. Here, heat is used. Now, olive oil is an integral part of the Mediterranean diet, but the main limitation is that olive oil does not have ideal omega-6 to omega-3 ratio. And second, the smoking point of olive oil is not very high, and it may not be very good for people in India who like their tadkas and they want oil to smoke so that they can use it for tadka. Now, this is a very interesting study I'll be discussing about sunflower oil. Now, in this study, this is from the Dr. Mohan's group. It was found, the patients were divided into 3 groups, and it was found that sunflower oil, which is polyunsaturated fatty acid rich, could aggravate the risk of metabolic syndrome, particularly in Asian Indian population. And why does this happen? Because Asian Indians, we habitually consume cereal and mainly refined grains with low intake of ALA. Use of traditional oils such as groundnut oil seems to be a better option than sunflower, as following things are ensured: optimal intake of MUFA, optimal intake of linoleic acid, and optimal ratio of the polyunsaturated fatty acid to the saturated fatty acid. Now, to reduce the LA-ALA ratio, that is the linoleic acid ALA ratio or the omega-6 omega-3 ratio, a single oil may not be adequate. And therefore, blended oils with lower LA-ALA ratio, we need more dietary sources of ALA, EPA, and DHA, along with whole grains, will actually help us to decrease the risk of insulin resistance and metabolic syndrome. Now, we need intervention studies with blended oils, and they are lacking. Now, again, does ghee have omega-3? See, ghee can be used in moderation because ghee is clarified butter. Ghee increases the LDL or the bad cholesterol because it contains saturated fats, but it also contains omega-3 fatty acids and unsaturated fats. The omega-3 are primarily linoleic acid and DHA. Now, if you take small or modest amounts of ghee, the LDL increases and also the HDL increases. So the ratio remains good. And you do need saturated fats also in your diet. So it's important that you can take ghee, but in moderation. Now, this is the content of various fats in ghee. Now, what about nuts and seeds? They contain mixture of fats, including MUFA, PUFA, and omega-3, and they are low in saturated fat. They're free of dietary cholesterol. So again, nuts and seeds are important source of good fats. Now, what about butter? Traditional butter contains 63% saturated fat, 26% MUFA, and 4% PUFA. Now, what is Neutralite? It's margarine. Margarine is an alternative to traditional butter. It is cholesterol free, does not have hydrogenated trans fat, and it is rich in MUFA and PUFA. We also have peanut butter and almond butter. They're very good substitutes. They are high in monounsaturated fatty acids, and almond butter contains more MUFA than even peanut butter. But like my previous speaker said, we have to know the socioeconomic status of the patient before we write such expensive substitutes. Now, it's important that when saturated fats are replaced with PUFA in the diet, total cholesterol decreases, LDL concentration decreases. But like modest amount of ghee, like I just told you, may increase LDL, but also the good cholesterol, HDL. Now, so it's a myth that we should use only one kind of oil. It's definitely important that we rotate the oils. We use 2 to 3 different oils because we need different MUFAs, different PUFAs. We also need some amount of saturated fat. So we can to give an example, one can use a seed oil like mustard oil. You can use a fruit oil like olive oil, and animal fat like ghee or maybe butter by rotation. Now, this is very important that the expert committee of WHO says that 0 trans fats by 2023, or at least the calories from trans fats should be less than 1%. Total fat intake, very simple to understand, should be 30% of the total calorie intake, 20% from proteins, and 50-55% from carbs. So if your total fat intake is 30%, 10% less than 10%, so 7% should come from saturated fats, 13% should come from monounsaturated fatty acids, and 10% from polyunsaturated fatty acids. So it's very simple that you should remember this rule. Now, trans fats less than 1%, and National Institute of Nutrition recommends this same thing, with 20 to 30% of total calories from fats. Now, recent studies have shown that in addition to absolute amount of omega-6 and omega-3, the omega-6 omega-3 ratio plays an important role in increasing the development of obesity. So if we can increase the intake of EPA and DHA, you can actually decrease obesity epidemic. Now, so we have good fats, the bad fats, and the ugly fats. Now, the ugly fats are definitely the trans fats. Now, this is a very interesting trial called the REDUCE-IT. In this, icosapent ethyl was used. It was an interventional trial, and in this, reduction of cardiovascular events was seen when icosapent ethyl. I'd like to tell you that this is an ethyl ester of EPA. So we just told you that EPA is a fatty acid. It is an essential fatty acid, EPA, and icosapent ethyl. So it was used in the dose of 4 grams. The primary endpoint was cardiovascular death, MI, stroke, and coronary revascularization, and unstable angina. The secondary endpoints were cardiovascular death, MI, and stroke, where it was found that giving 4 grams per day significantly reduced cardiovascular events. So this is a very, very interesting trial. But we have another trial called the Strength Randomized Controlled Trial. In this trial, the statin-treated patients with a very high cardiovascular risk, a high triglyceride, and a low HDL, omega-3 fatty acids were added. But this was a negative trial, and when you compared it with corn oil, these findings did not support the use of omega-3 fatty acid formulation to reduce major adverse cardiovascular events in high cardiovascular group patients. Now, this is the PURE study. It took the whole world by storm, the prospective urban-rural epidemiological study. This study was conducted in 21 countries across 5 continents, and a questionnaire was used. Underreporting of food intake definitely happens in a questionnaire because it's by recall. Now, what happened? It's important that we always have been told decrease saturated fat, but we have not instructed our patients decrease saturated fat and replace it with what? So probably in this study, high carb intake increased total mortality. It wasn't the high fat intake. It was found that the high fat intake is associated with a lower risk of total mortality and is not associated with the risk of MI or cardiovascular mortality. So the PURE trial was exactly opposite what we have been taught for so many years. But is the PURE trial to be taken on face value? No, we don't think so. Because if you replace saturated fats or fats, what do you replace it with? If you replace it with polyunsaturated fatty acids, you get better results. But what if you replace it with refined grain? What are poor people do? So this study was in low income, middle income, and high income group. Probably the fats were replaced by refined carbs. Therefore, there was increased mortality. So we must remember that it's important to know what you are replacing the fat with, right? So the big dilemma is replacement nutrient. Therefore, this study did not analyze what you had replaced the SFA with. And important is that you replace the SFA or the saturated fat with polyunsaturated fatty acids, right? So this is important. And now I'll skip this slide. So good 2020 dietary guidelines, what's good, what's bad. This is very important. Benefits of a plant-based diet, cut cholesterol and saturated fat, but you can get some saturated fat if the patient is diabetic or has a high risk of cardiovascular disease or already has established cardiovascular disease. Less than 7% of the total calories should come from saturated fat. You should not eat red and processed meat to protect against type 2 diabetes and heart disease. Now, again, this guideline does not warn against dairy products. And we remember that dairy products are also rich in saturated fat, right? Now, what about a low carb diet? There is increasing consensus now that low carb diet is good. But when you say low carb, what do you mean? Is it a high fat diet and what fats? So you have to replace the carbs, refined carbs, with good fats. So extra virgin olive oil, you can replace it with nuts, with oily fish. There should be moderate intake of cheese for the moderate saturated fat that you get, moderate intake of yogurt, and your diet should be low in sugar. That means foods which are included are high in fiber and low in GI and GL. So this is the diet. So it decreases insulin resistance because it is the excess fructose and refined carbs which are atherogenic. So to decrease systemic inflammation, we must take at least not too much of omega-3. So suboptimal omega-3, too much of omega-6 again will cause inflammation. And therefore, not only saturated fats should be decreased, MUFA should be increased. And the ratio of, in the PUFA, the ratio of omega-6 to omega-3 is very important. So from the pure trial, there is good evidence that reducing saturated fats but replacing them with polyunsaturated fats improves the LDL cholesterol, thereby reducing the risk of cardiovascular disease. There is no evidence that very high intake of saturated fats are beneficial, although from old times we have been listening to our grannies say that ghee is good. So ghee is good in moderation because it will increase both LDL and HDL. Dietary advice to reduce SFA alone is very simplistic. You don't have to tell the patient, just say decrease fats. You have to remember not just the quantity but also the quality of fat. So replacing the saturated fat with unsaturated fat or with complex carbohydrates like whole grains is beneficial. And you should not replace the fat with refined carbs like maida or trans fatty acids. This could be detrimental. So practical advice about SFA is better communicated in the context of food choices. Here comes the role of the diet educator or the nutritionist. So it's not the doctor just handing out a prescription saying decrease saturated fat, but it should be what food choices to make. So make food choices which have a very good proportion of all the fatty acids. Now, dietary patterns that encourage fruit and vegetables, which give you the good carbs, whole grains, again, complex carbs, pulses for the proteins, and nuts, which give you healthy fats, seeds also, which give you healthy fats, oily fish, which will again provide you healthy fat, discourage red and processed meat, high in cholesterol, high calorie fast foods, which are high in trans fats, sugary drinks, and refined carbohydrates are not recommended. So it's important, the take-home message is that fats are important. We cannot get away with fats. You can't have a low fat diet and go down on the calories from fat to less than 20%. Fats should provide at least 25 to 30% of the daily energy intake. Then saturated fat should be less than 10%, and people with type 2 diabetes and cardiovascular disease, it should be about 7%. PUFA should be 10%, and PUFA includes both omega-6 and omega-3 fatty acids. Omega-3 or PUFA, ALA, should be about 0.5 to 2%. adults should consume 250 milligram per day of the long chain omega-3 fatty acid, that is EPA and DHA. Now, again, this trial, the reduced IT trial, has proved that taking 4 grams of EPA, it's not yet available in India, taking 4 grams, and now there's a study from Japan that even 2 grams of that has led to reduction in cardiovascular mortality. So if we could incorporate EPA and DHA in our diets, these are long-chain omega-3 fatty acids, there can be a reduction in the risk of cardiovascular disease. Now, trans fats should not exceed 1%. They should be less than 1%, because even if they are 2%, the risk of cardiovascular disease increases by 23%. And remainder of the energy should come from the monounsaturated fatty acids, which are definitely present in olive oil. Here, I'd like to reiterate that blending of oils is important. So my take-home message is no one oil has the right amount of all fatty acids. So you should be rotating oil. You need saturated fat. So you need a little amount of desi ghee or butter, but not too much. You need monounsaturated fatty acids, and you do need PUFA and omega-3 and omega-6 in the right ratio. Thank you.